Alzheimer's disease is the most common cause of dementia among adults ages 65 and older, impacting millions of America. And with treatments available that now address the underlying disease, early diagnosis can bring hope for patients like Doyle Scott. Doyle is here with his dementia care specialist, Dr. Shah. Good morning, gentlemen. How are you both doing?
Good morning. Good.
Good morning. Thank you for having us.
Yeah, absolutely. I'm pumped to be speaking with you. So, kind of tell me, what is early Alzheimer's disease and what do we need to know?
Yeah, we are glad to be here. We are happy to be partnering with ASI and Biogen to be talking about this disease. So what by when we use the term early Alzheimer's disease, it refers to mild cognitive impairment or MCI and early changes of Alzheimer's disease in the form of mild Alzheimer's disease. So, and the reason it's important to distinguish that a lot of people ask me the question, is it same as aging? No, it's not. So in compared to normal aging, in case of early Alzheimer's disease, there's a quicker, rapid progression, and there are more changes which happens to the brain.
Hmm. So, Doyle, can you tell me a little bit more about your diagnosis, and maybe what some of your kind of first or early symptoms were?
Yeah, probably mine revolved around having trouble staying organized and on schedule. That was very uncharacteristic for me. I'd spent a career as a teacher, principal, and superintendent, and organization and being in the right place at the right time was very important for me. So consequently, when I started having trouble with that, and specifically, my wife was telling me things and I wasn't remembering them. My wife and I talked about with our doctor about it. Our doctor referred to us to Dr. Shah. He then confirmed my early Alzheimer's disease diagnosis and started me on Leqembi. I'm very glad to be on Leqembi, which has helped me to continue to be able to do the things we enjoy, like spending time with our family. I continue to play golf, to do just about the things I've normally done.
Yeah, absolutely. So, Dr. Shaw, can you tell me a little bit more about kind of why it's important to early diagnose this disease?
Yeah, prompt diagnosis is extremely important for multiple reasons. One, with prompt diagnosis, we can have patients plan their life better, and now they can have options like for treatment like Leqembi. And then Leqembi, as we mentioned earlier, Leqembi is FDA approved and is given through infusion in intravenously to patients in very early stages, or it's called mild cognitive impairment or mild dementia due to Alzheimer's disease.
So then, Doyle, can you tell me a little bit more how you feel that Leqembi has benefited you in your treatment kind of throughout this process?
Certainly. When I started on Leqembi, then one of the things we were concerned about a little bit was side effects and if there would be any. And I had a side effect after I had my first infusion in that they had told me not to do much, but I decided to go home and exercise. And consequently, I had some trouble as a result of that in terms of I vomited. But since then, I've had absolutely no issues with side effects, or at least very minor issues with side effects. As I've said, I'm thankful to still be golfing. I still do reading. I've taught a Sunday school class, and we do the traveling. So these are my results, but everyone's going to be different.
Yeah, absolutely. So, Dr. Shaw, Doyle talked a little bit about some of his side effects of the medicine, but is there any safety concerns that you want patients to be aware of?
Yeah. Like most medications would have some side effects or some safety concerns. Leqembi does have serious safety concerns in the form of ARIA, which stands for amyloid-related imaging abnormality. This also can put small but chance of allergic reactions or chance for infusion-related reaction. What Doyle mentioned, vomiting and other symptoms can happen. Uh, the ARIA is a temporary swelling in the brain, certain parts of the brain, and it's a temporary. So most of the cases, it gets better with time. But these are the safety, and there are a few couple of more, but that people have to be watching for them, as Doyle mentioned. And we, before giving, we give a lot of good education to our patients about the potential of serious and other side effects.
Yeah, absolutely. So then, Doyle, what's maybe the most important thing that you want others that are affected by Alzheimer's disease to kind of know about the treatment and then also your personal experience with Leqembi, something that maybe will be beneficial or helpful for them to know?
The first thing, and maybe the most important thing, is that there is hope. When my father had Alzheimer's disease, there wasn't much they could do for him. Now there are things you can do, but you need to catch it in the beginning stages. It can help slow the progression of Alzheimer's disease in some people. So get with your doctor and find out some more information about that to see if this is the right thing for you.
Yeah, absolutely. And like you said, getting with your doctor, I think, is important. We want to make sure this is the right process for you because not the same thing works for everyone. Now, Dr. Shah, where can people go for more information for everything that we've talked about this morning?
Yeah, there's a simple website. It goes by the name of the drug, which is leqembi.com. I'll spell it out. It's LEQEMBI.com, and it gives good information about who are the right patients, what are the safety concerns, and anything patients and the providers, the physicians who are going to prescribe need also.
Perfect. Well, gentlemen, thank you so much for your time this morning. It was a pleasure getting to speak with the both of you. And for all of you out there, make sure you're getting the right care for yourself and for your loved ones. Thank you, guys.
Thank you. Thank you.
Thank you for having us.